Hello, we're going to talk about the impact of nutrition on health. We are the group 1 and these are our integrants. Okay, the case is about a young woman, 22-year-old. Her profession is dentist and she came to the consult because she feels very tired, so she have fatigue, also have tachycardia, and she knows that he is losing her hair. Tachycardia is when the heartbeat is so fast. Okay. In the diet, we ask about her diet, and she says that she eats too many snacks like French fries and processed food, and also she doesn't eat red meat. And also we know that she drinks too much black coffee. Okay, and in the laboratory exams, in her blood test, the hemoglobin is in 10.2, which is below the normal level for women, that is in reference 12 to 16. Okay, also we know that the additional observations is that she hasn't bleeding or chronic issues and also no medication. Okay, we infer that is a type of anemia, namely the iron deficiency anemia, because this is likely common in poor diet, and this woman have poor diet. She doesn't eat in red meat, that is so important in iron. Also, these symptoms happen because there is enough iron, and the body can make enough hemoglobin because the iron is related with hemoglobin. So, low iron, low hemoglobin. Hemoglobin is a protein that carries the oxygen to the cells. It carries the oxygen into all the blood, and without this oxygen, the body doesn't work well. Okay, for that reason, when the hemoglobin is also down, we know these symptoms: fatigue, tachycardia, hair loss, and pale skin. The secondary symptoms is hair loss and pale skin. Okay, we know fatigue is because the patient feels weak and tired because her tissues doesn't get enough oxygen. And also because in this type of iron deficiency anemia is a common low level of iron named the iron heme. In Spanish is hierro hemo. So for that reason, reduce the production of hemoglobin. Tachycardia is related with this because the heart beats faster to try to compensate more oxygen, while the hemoglobin doesn't transport the oxygen. For that reason, happens tachycardia. So this is so relative to the circulation of our body. And for that reason, we say that the patient is with pale skin because when hemoglobin is low, we doesn't have enough oxygen. The skin and the mucous membranes lose the color and looks like so white. For example, in the hands or in the mucous membranes. And also we know that this is a relation with the cold circulation or cold articulations, because we know, for example, that the hands are too cold and also are white. And the hair loss. Iron is important for the hair growth, so without this mineral, the hair falls out. Also, we know that the coffee black is like a block of the absorption of iron, because these have some chemics that blocks that type of iron. Okay, we also know that vitamin C that is present, for example, in this case is orange or another element. Vitamin C is so important because absorbs the iron in a well form. And iron is so present in red meat and also in green vegetables in majority. And also we know that iron deficiency anemia means that the body does not have enough iron to make hemoglobin, what I said before. So hemoglobin, what is that? It's a protein in red blood cells that carries the oxygen through all the body into the blood. Okay, and without this iron, the body makes smaller and weaker red blood cells. In Spanish, los glóbulos rojos. Iron is absorbed in the duodenum, that is a part of the small intestine. Small intestine is where we absorb all our nutrients of the aliments, and then it travels through the blood using a transport protein named transferrin. Transferrin sends the iron to the organs they need more, like the liver, the bone marrow, and the spleen. In Spanish, hígado, médula ósea y vaso. Okay, and in the bone marrow, iron is used to make hemoglobin. See, and each hemoglobin molecule needs 4 atoms of iron to work properly. And also we know that is a protein named ferritin. Ferritin stores the iron in the liver, in the spleen, and in the bone marrow. When iron starts to go down, the ferritin levels fall first. Okay, it's a relation. So ferritin is a good early sign of iron deficiency, even before the hemoglobin goes down. It's like an order. First, iron deficiency is seen with the ferritin levels, and then the hemoglobin starts to go down.
Several tests are requested to confirm the diagnosis. The blood count shows us if the red blood cells are small and have little hemoglobin. Ferritin is also measured, which indicates how many iron reserves the body has. In iron deficiency anemia, ferritin is low. Other tests include iron in the blood, the carrying capacity of iron, reticulocytes, and also vitamin B12, folate, and thyroid profile to rule out the other causes of fatigue and hair loss. Anemia ferropenica, production of red blood cells. Ferritin stores iron in the liver, spleen, and bone marrow. In iron deficiency, ferritin drops before hemoglobin. The impact on cellular metabolism is with less hemoglobin, less oxygen reaches the cells. ADP production through aerobic respiration is reduced. Anaerobic glycolysis increases, generating less energy and lactic acid. And the function of organs with high energy demands brain, heart, muscles is affected. Case diagnosis relation. Well, we have classic symptoms of anemia, low iron intake, and decreased hemoglobin. About the diagnosis, mild to moderate iron deficiency anemia, confirmed by clinical symptoms and low hemoglobin. About the treatment, supplementation based on specific needs, taking into account weight and individual factors, nutritional education, focus on the patient's lifestyle, and an iron-rich diet. Finally, nutritional recommendations are very important. The first thing is to increase the consumption of foods rich in heme iron, such as meat, viscera, chicken, or fish, which the body absorbs much better. You should also include sources of vegetable iron such as lentils, spinach, or beans, and combine them with foods rich in vitamin C, such as guava, orange, or kiwi, to improve their absorption. It is important to avoid drinking coffee, tea, or milk just with meals, since this blocks the absorption of iron. It is also recommended to have a more complete diet. Make 3 meals and 2 snacks. Include proteins in each meal, avoid ultra-processed foods, and if possible, work with a nutritionist to make changing habits easier and more lasting. And for conclusion, this is a typical case of iron deficiency anemia due to poor diet, improved with supplements and dietary changes. Thank you so much for your attention.